Hey, Alpha I'm Licensure from AlphaNurseGuide.com. This is gastrointestinal and nutrition questions. Without delay, let's get started.
The patient has portal hypertension and hepatic encephalopathy secondary to liver disease and is being treated with lactulose. Which laboratory result will the nurse check first to see if the medication is having the desired effect? 1. White blood cell count. 2. Ammonia level. 3. Potassium level. 4. Platelet count. The correct answer is 2. Ammonia level. Rationale. The healthy liver breaks down ammonia, but in liver disease, the ammonia accumulates and serum levels increase. Lactulose helps by enhancing intestinal excretion of ammonia. An older adult patient tells the home health nurse that she is taking methylcellulose for chronic constipation. Which behavior is cause for greatest concern? 1. Patient primarily eats white bread and drinks low-fat milk. 2. Patient takes the methylcellulose 3 or 4 times a day. 3. Patient takes the medication with a few sips of water. 4. Patient does not promptly act on the urge to defecate. The correct answer is 3. Patient takes the medication with a few sips of water. Rationale. Methylcellulose can cause esophageal obstruction if taken with insufficient amounts of fluid. Intestinal obstruction is also a possibility if the passage is slowed or impeded. The patient should be reminded that 3 times a day is the acceptable dose range. High fiber and a prompt response to the urge to defecate should be encouraged to restore natural and normal bowel movements. A patient with end-stage liver disease is talking to the nurse about being on the transplant list. Which statement by the patient is cause for greatest concern? 1. I have a family history of diabetes. 2. I had symptoms of asthma when I was a kid. 3. I guess I should cut back on my alcohol consumption. 4. I am not very good about taking prescribed medication. The correct answer is 3. I guess I should cut back on my alcohol consumption. Rationale. If alcohol abuse has contributed to liver failure, a person's intent to continue alcohol consumption might be an exclusion for a liver transplant, so the nurse should conduct an additional assessment about this comment. The comment about the difficulty in taking prescription medications should also be investigated because a true inability to follow the treatment regimen could exclude a patient from being on a transplant list. The patient with advanced cirrhosis has massive ascites, peripheral dependent edema in the lower extremities, nausea and vomiting, and dyspnea related to pressure on the diaphragm. Which indicator is the most reliable for tracking fluid retention? 1. Auscultating the lung fields for crackles every day. 2. Measuring the abdominal girth every morning. 3. Performing daily weights with the same amount of clothing. 4. Checking the extremities for pitting edema and comparing with baseline. The correct answer is 3. Performing daily weights with the same amount of clothing. Rationale. All of these measures should be performed for total care of the patient. However, weighing the patient every day is considered the single best indicator of fluid volume. After a nasogastric tube is inserted, which assessment finding is cause for greatest concern? 1. The patient reports that the tube is irritating nose and throat feels sore. 2. Gastric contents have a coffee ground appearance. 3. The patient demonstrates coughing and cannot speak clearly. 4. Gastric fluid is bright red and has small clots. The correct answer is 3. The patient demonstrates coughing and cannot speak clearly. Rationale. Coughing and an inability to speak or difficulty in speaking clearly suggests that the tube has been inserted into the trachea. The tube should be removed immediately. Bright red blood with clots indicates active bleeding. This should be immediately reported to the healthcare provider. Coffee ground appearance of gastric contents indicates old blood. This finding should also be reported but is less urgent. Irritation of the throat and around the nares is commonly reported. Perform hygiene around the nares as needed. Irritation of the throat usually subsides, but an anesthetic throat spray may offer some temporary relief. The nurse is caring for a patient who was recently admitted for severe diverticulitis. Which task is appropriate to delegate or assign for the care of this patient? 1. Tell the unit secretary to call radiology and schedule a barium enema. 2. Ask the LPN/LVN to give as needed laxatives for constipation. 3. Instruct the nursing student to help the patient ambulate up and down the hall. 4. Tell assistive personnel to save a stool specimen to test for occult blood. The correct answer is 4. Tell assistive personnel to save a stool specimen to test for occult blood. Rationale. Diverticulitis can cause chronic or severe bleeding, so if there is no obvious blood in the stool, The stool may be tested for occult blood. A barium enema is not usually ordered because of the danger of perforation. Laxatives and ambulation increase intestinal motility and are to be avoided in the initial phase of treatment. If a barium enema, PRN laxative, or ambulation is prescribed, the nurse should check with a healthcare provider before delegating or assigning the intervention. A patient underwent an exploratory laparotomy 2 days ago. The healthcare provider should be called immediately for which assessment finding: 1. Abdominal distension and rigidity. 2. Absent or hypoactive bowel sounds. 3. Nausea and occasional vomiting. 4. Displacement of the nasogastric tube. The correct answer is 1. Abdominal distension and rigidity. Rationale: distension and rigidity can signal hemorrhage or peritonitis. The HCP may also decide that these symptoms require medication to stimulate peristalsis. Absence of bowel sounds is expected within the first 24 to 48 hours. Nausea and vomiting are not uncommon and are usually self-limiting, and an as-needed prescription for an antiemetic is usually part of the routine postoperative care. The NG tube should be assessed for displacement, and the correct position of the tube must be confirmed. The nurse then secures the tube as necessary. The nurse is caring for a patient with cirrhosis and portal hypertension. Which statement by the patient is cause for greatest concern? 1. I'm very constipated and have been straining during bowel movements. 2. I can't button my pants anymore because my belly is so swollen. 3. I have a tight sensation in my lower legs when I forget to put my feet up. 4. When I sleep, I have to sit in a recliner so that I can breathe more easily. The correct answer is 1. I'm very constipated and have been straining during bowel movements. Rationale: portal hypertension increases pressure in the venous system and contributes to the development of esophageal varices, which are very fragile. Straining increases thoracic or abdominal pressure, which can cause a sudden rupture of fragile blood vessels with massive hemorrhage. The patient could have fluid accumulation in the abdomen that may be mild and hard to detect or severe enough to cause orthopnea. Patients will compensate for orthopnea by assuming a more upright position. This symptom warrants additional investigation. Dependent peripheral edema can also be observed but is less urgent. Generally, respiratory issues are the priority. However, this question calls for knowledge of pathophysiology of cirrhosis and portal hypertension. Rupture with hemorrhage is the most serious complication. An older adult patient tells the home health nurse that he puts 17 grams of polyethylene glycol in a large cup of coffee every morning. Which assessment will the nurse perform first? 1. Assess for signs and symptoms of dehydration or electrolyte imbalances. 2. Assess for signs and symptoms of malnutrition and nutritional deficiencies. 3. Ask the patient to describe frequency and consistency of bowel movements. 4. Ask the patient what he understands about the purpose of the medication. The correct answer is 3. Ask the patient to describe frequency and consistency of bowel movements. Rationale: the patient is taking the recommended dose of polyethylene glycol. Polyethylene glycol is used for the treatment of chronic constipation, so the nurse would assess the effect that the medication is having on bowel movements. Older adult patients generally have a greater risk for dehydration, fluid and electrolyte imbalances, and nutritional deficiencies, so these would be included in routine assessment. Reviewing understanding of medications is always a good idea if the nurse has time. The nurse is caring for an obese postoperative patient who underwent surgery for bowel resection. As the patient is moving in bed, he comments, "Something popped open." Upon examination, the nurse notes wound evisceration. Place the steps in order for handling this complication. 1. Cover the intestine with sterile moistened gauze. 2. Stay calm and stay with the patient. 3. Check the vital signs, especially blood pressure and pulse. 4. Ask assistive personnel to get sterile supplies. 5. Put the patient into a semi-fowler position with knees slightly flexed. 6. Prepare the patient for surgery as ordered. 7. Ask the charge nurse to call the surgeon. The correct order is 2. Stay calm and stay with the patient. 5. Put the patient into semi-fowler position with knees slightly flexed. 3. Check the vital signs, especially blood pressure and pulse. 7. Ask charge nurse to call the surgeon. 4. Ask assistive personnel to get sterile supplies. 1. Cover the intestine with sterile moistened gauze. And 6. Prepare the patient for surgery as ordered. Rationale: stay calm and stay with the patient. Any increase in intra-abdominal pressure will worsen the evisceration. Placement of the patient in a semi-fowler position with knees flexed will decrease the strain on the site. Continuously monitor vital signs while the charge nurse notifies the surgeon. An AP can obtain sterile supplies. Covering the site protects the tissue. Ultimately, the patient will need emergency surgery. The charge nurse is reviewing the medication administration records for several patients, which situation needs to be brought to the attention of the prescribing healthcare provider. 1. A patient with gastroesophageal reflux disease is receiving omeprazole. 2. An older adult patient with constipation is getting psyllium 3 times a day. 3. A patient who needs a bowel prep is getting a polyethylene glycol electrolyte solution. 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. The correct answer is 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. Rationale. Bisacodyl is a laxative, and laxatives should not be administered to patients with undiagnosed abdominal pain, cramps, or nausea. Appendicitis, diverticulitis, ulcerative colitis, acute surgical abdomens, and bowel obstruction are also contraindications for laxative use. The other patients are receiving medications that are appropriate for their conditions. Omeprazole is a proton pump inhibitor that reduces stomach acid and relieves heartburn. Psyllium is a bulk-forming laxative that is used to treat constipation. The medication needs to be taken with a full glass of water. Polyethylene glycol electrolyte solution is a laxative solution that is prescribed to prepare the colon for procedures, such as a colonoscopy. The nurse is planning a treatment and prevention program for chronic bowel incontinence for an older patient. Which intervention should the nurse try first? 1. Administer a glycerin suppository 15 minutes before evacuation time. 2. Insert a rectal tube at specified intervals each day. 3. Assist the patient to the commode or toilet 30 minutes after meals. 4. Use incontinence briefs or adult-sized diapers. The correct answer is 3. Assist the patient to the commode or toilet 30 minutes after meals. Rationale. The goal of bowel training is to establish a pattern that mimics normal defecation, and many people have the urge to defecate after a meal. If this is not successful, a suppository can be used to stimulate the urge. The use of incontinence briefs is embarrassing for the patient, and they must be changed frequently to prevent skin breakdown. Routine use of rectal tubes is not recommended because of the potential for damage to the mucosa and sphincter tone. A nursing student is performing a colostomy irrigation. When would the nurse intervene? 1. Student hangs the prepared irrigation container on the bed rail. 2. The student puts 500 to 1,000 milliliters of lukewarm water in the container. 3. Student cleans, rinses, and dries the skin and applies a new drainage pouch. 4. The student encourages the patient to walk for 30 to 45 minutes for secondary evacuation. The correct answer is 1. Student hangs a prepared irrigation container on the bed rail. Rationale. The nurse will remind the student that the container has to be hung at shoulder level. If the container is too low, the flow will be sluggish. If the container is below the entry site, the solution will flow retrograde. If the container is too high, the solution will flow too quickly and cause cramping. The other actions are correct. For the postoperative care of a morbidly obese patient, which task best utilizes the expertise of the LPN/LVN under the supervision of the RN team leader? 1. Obtaining an oversized blood pressure cuff and a large-size bed. 2. Setting up a reinforced trapeze bar. 3. Assisting in the planning of toileting, turning, and ambulation. 4. Assigning tasks to assistive personnel and other ancillary staff. The correct answer is 3. Assisting in the planning of toileting, turning, and ambulation. Rationale. The LPN/LVN can offer valuable assistance in planning the interventions, but the RN has ultimate responsibility for the care plan. The LPN/LVN can delegate and assign tasks to APs. However, if the RN is a team leader, it is better if APs are not receiving instructions from multiple people. Obtaining equipment should be delegated to an AP. A physical therapist should set up specialized equipment. Which patient is the most appropriate to assign to an LPN/LVN under the supervision of an RN? 1. A patient with oral cancer who is scheduled for a glossectomy in the morning. 2. An obese patient who has returned from surgery after a vertical banded gastroplasty. 3. A patient with anorexia nervosa who has muscle weakness and decreased urine output. 4. A patient with intermittent nausea and vomiting after chemotherapy. The correct answer is 4. A patient with intermittent nausea and vomiting after chemotherapy. Rationale. Nausea and vomiting are common after chemotherapy. Administration of antiemetics and fluid monitoring can be done by an LPN/LVN. The RN should perform the preoperative teaching for the glossectomy patient. Patients returning from surgery need extensive assessment. The The patient with anorexia is showing signs of hypokalemia and is at risk for cardiac dysrhythmias. The nurse is providing the immediate postoperative care for a patient who had fundoplication to reinforce the lower esophageal sphincter for the purpose of a hiatal hernia repair. What is the priority action in the care of this patient? 1. Elevate the head of the bed at least 30 degrees. 2. Assess the nasogastric tube for yellowish-green drainage. 3. Assist the patient to start taking a clear liquid diet. 4. Assess the patient for gas bloat syndrome. The correct answer is 1. Elevate the head of the bed at least 30 degrees. Rationale. The primary concern in the immediate postoperative period is the potential for airway complications. Elevating the head at least 30 degrees decreases the chance for aspiration and facilitates respiratory effort. The other options are also correct, but will occur later in the postoperative period. The ABCs, airway, breathing, and circulation, underlie the priorities of care when the patient has an invasive procedure. You can use the concept of gas exchange to answer this question, even if you are not familiar with the specific details of the procedure. In the care of a patient with gastroesophageal reflux disease, which task would be appropriate to delegate to assistive personnel? 1. Sharing successful strategies for weight reduction. 2. Encouraging the patient to express concerns about lifestyle modification. 3. Reminding the patient not to lie down for 2 to 3 hours after eating. 4. Explaining the rationale for eating small frequent meals. The correct answer is 3. Reminding the patient not to lie down for 2 to 3 hours after eating. Rationale. Reminding the patient to follow through on advice given by the nurse is an appropriate task for the AP. The nurse should take responsibility for teaching rationale, discussing strategies for the treatment plan, and assessing patient concerns. The nurse is taking an initial history for a patient seeking surgical treatment for obesity, which findings should be called to the attention of the surgeon. 1. Obesity for approximately 5 years. 2. History of counseling for body dysmorphic disorder. 3. Failure to reduce weight with other forms of therapy. 4. Body weight 100% above the ideal for age, gender, and height. The correct answer is 2. History of counseling for body dysmorphic disorder. Rationale. Body dysmorphic disorder is a preoccupation with an imagined physical defect. Corrective surgery can exacerbate this disorder when the patient continues to feel dissatisfied with the results. The other findings are criterion indicators for this treatment. For a patient with short bowel syndrome, the nurse would question the prescription of which enteral formula? 1. High sodium content. 2. High fat content. 3. High protein content. 4. Modified carbohydrate content. The correct answer is 2. High fat content. Rationale. Patients with short bowel syndrome have impaired fat absorption as a result of limited surface area. Formulas with high sodium content would not be prescribed for heart failure. High protein formulas can contribute to dehydration if adequate water is not given. Modified carbohydrate content is prescribed for patients with chronic obstructive pulmonary disease when they require nutritional support. Which laboratory results would the nurse check to determine if there are untoward effects associated with vomiting, nasogastric suction, or lavage? 1. White blood cell counts. 2. Hematocrit and hemoglobin. 3. Serum electrolytes. 4. Blood urea nitrogen and serum creatinine. The correct answer is 3. Serum electrolytes. Rationale. The nurse monitors all laboratory results, but vomiting, nasogastric suction, and lavage can cause fluid and electrolyte imbalances. Fluid loss can cause hemoconcentration and artificially elevated levels for hematocrit, hemoglobin, and blood urea nitrogen. Blood urea nitrogen is generally more affected by fluid loss than serum creatinine. The WBC count could be elevated because of stress, inflammation, or infection. Which question will the nurse ask the student nurse who is assigned to do an enteral feeding for a patient with a small bore feeding tube? 1. Have you evaluated the nutritional status of the patient? 2. Is the patient tolerating the supine position after feedings? 3. Have you had any problems checking the residual? 4. Is the patient developing any problems related to the feedings? The correct answer is 3. Have you had any problems checking the residual? Rationale. A disadvantage of small bore feeding tubes is that they are prone to clogging, and checking for residuals can be difficult. If the tube gets clogged, it may have to be removed and reinserted. Placing the patient in a supine position is incorrect. The head of the bed needs to be elevated 30 degrees to 45 degrees during feedings and for 30 to 60 minutes after the feeding to reduce the risk of aspiration. The nurse is reviewing medication lists for patients who are being treated for peptic ulcer disease. The nurse is most likely to question the use of which medication? 1. Ibuprofen. 2. Omeprazole. 3. Amoxicillin. 4. Clarithromycin. The correct answer is 1. Ibuprofen. Rationale. Ibuprofen is a non-steroidal anti-inflammatory drug, and NSAIDs are thought to be one of the aggravating factors of peptic ulcer disease. Omeprazole, amoxicillin, and clarithromycin are used as a triple combination therapy for the treatment of peptic ulcer disease. A male nurse tells an older male patient that he needs to perform a digital examination of the rectum to check for possible fecal impaction. The patient responds, "I'm not letting any male nurse get near me." What should the nurse do first? 1. Explain that the procedure is a nursing action, not a sexual advance. 2. Ask the charge nurse to reassign that patient to a different nurse. 3. Document that the patient refused to allow the examination. 4. Ask the patient if the presence of a female staff member would be acceptable. The correct answer is 4. Ask the patient if the presence of a female staff member would be acceptable. Rationale. The nurse is likely to feel upset, even angry. However, ideally, the nurse focuses on the patient and tries to find a solution that allows the care to continue. Having a female witness in the room may reassure the patient that nothing untoward will happen. If the patient continues to express hostility and rejection, then the nurse could ask the charge nurse to reassign the patient. In cases of emergency, the nurse would acknowledge the patient's feelings, but politely and firmly explain that the intervention can't be delayed. All attempts and interventions should be documented. The nurse is supervising a nursing student who is caring for a patient who had a cholecystectomy. There is a T-tube in place. The nurse would intervene if the student performed which action? 1. Maintain the patient in a semi-fowler position. 2. Check the amount, color, and consistency of the drainage. 3. Gently aspirated the drainage from the tube. 4. Inspected the skin around the tube for redness or irritation. The correct answer is 3. Gently aspirated the drainage from the tube. Rationale. T-tubes should not be irrigated, aspirated, or clamped without specific directions from the healthcare provider. All of the other actions are appropriate in the care of this patient. The nurse hears in the handoff report that, 1 hour ago, the healthcare provider requested that the patient be given the maximum dose of magnesium hydroxide. Which instruction is the nurse most likely to give to assistive personnel? 1. Patient will frequently need assistance to the bathroom for bowel evacuation. 2. Patient may experience some dizziness when ambulating or changing position. 3. Patient is frequently vomiting and may need linen and gown changes. 4. Patient needs to be encouraged and assisted to eat and drink as much as possible. The correct answer is 1. Patient will frequently need assistance to the bathroom for bowel evacuation. Rationale. The maximum dose of magnesium hydroxide is given for bowel evacuation and cleansing. It is expected that the medication should take effect within 2 to 6 hours. Patients who are undernourished or starved for prolonged periods are at risk for refeeding syndrome when nourishment is first given. What is the priority nursing assessment to prevent complications associated with this syndrome? 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. 2. Monitor for decreased bowel sounds, nausea, bloating, and abdominal distension. 3. Observe for signs of secret purging and ingestion of water to increase weight. 4. Assess for alternating constipation and diarrhea and pale clay-colored stools. The correct answer is 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. Rationale. Refeeding syndrome occurs when aggressive and rapid feeding results in fluid retention and heart failure. Electrolytes, especially phosphorus, should be monitored, and the patient should be observed for signs of fluid overload. Changes in bowel sounds, nausea, and distension may occur but are also appropriate for any patient with nutritional issues or for patients receiving enteral feedings. Observing for purging and water ingestion would be appropriate for a patient with an eating disorder. Changes in stool patterns may occur, but are not related to refeeding syndrome. A patient is admitted to the medical surgical unit for observation after being evaluated in the emergency department for blunt trauma to the abdomen. Which instructions would the RN give to assistive personnel? 1. Check the patient's skin temperature and report if the skin feels cool. 2. Check the urometer every hour and observe for red or pink-tinged urine. 3. Check vital signs every hour and report all of the values. 4. Check the patient's pain and report worsening of pain or discomfort. The correct answer is 3. Check vital signs every hour and report all of the values. Rationale. The AP can take vital signs and report all of the values to the RN. In this case, all of the values are needed to detect trends. In other cases, the nurse may decide to give parameters for reporting. The RN should assess skin temperature and pain. The RN must also closely monitor the urine output, which is an indicator of perfusion and fluid status. In addition, red or pink urine can signal damage to the urinary system, transfusion reaction, or rhabdomyolysis. Which instruction will the RN give to the LPN/LVN to determine if the prescribed dronabinol, medical marijuana, is having the desired therapeutic effect? 1. Monitor and report bouts of nausea and vomiting. 2. Monitor the frequency and amount of diarrheal episodes. 3. Ask the patient if heartburn has decreased or resolved. 4. Assess for abdominal pain in the upper right quadrant. The correct answer is 1. Monitor and report bouts of nausea and vomiting. Rationale. Dronabinol medical marijuana is prescribed to treat nausea and vomiting. For patients coming to the ambulatory care gastrointestinal clinic, which task would be most appropriate to assign to an LPN/LVN? 1. Teaching a patient self-care measures for an ulcer. 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. 3. Evaluating a patient's response to sitz baths for an anorectal abscess. 4. Describing the basic pathophysiology of an anal fistula to a patient. The correct answer is 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. Rationale. Assisting with procedures for patients in stable condition with predictable outcomes is within the educational preparation of the LPN/LVN. Teaching the patient about self-care or pathophysiology and evaluating the outcome of interventions are responsibilities of the RN. In the care of a patient with acute viral hepatitis, which task would be delegated to assistive personnel? 1. Emptying the bedpan while wearing gloves. 2. Engaging the patient in diversional activities. 3. Monitoring dietary preferences. 4. Reporting signs and symptoms of jaundice. The correct answer is 1. Emptying the bedpan while wearing gloves. Rationale. The AP should use infection control precautions for the protection of self, employees, and other patients. Monitoring is a nurse responsibility. APs can report valuable information. However, they are not responsible for detecting signs and symptoms that can be subtle or hard to detect, such as skin changes. Engaging patients in diversional activities is the ideal. However, it is rarely possible on a busy medical surgical unit. The nurse is providing postoperative care for a patient who underwent laparoscopic cholecystectomy. What should be reported immediately to the healthcare provider? 1. The patient cannot void 5 hours postoperatively. 2. The patient reports shoulder pain. 3. The patient reports right upper quadrant pain. 4. Output does not equal input for the first few hours. The correct answer is 3. The patient reports right upper quadrant pain. Rationale. Right upper quadrant pain is a sign of hemorrhage or bile leakage. The ability to void should return within 6 hours postoperatively. Right shoulder pain is related to unabsorbed carbon dioxide and will be resolved by placing the patient in a Sims position. For the first several hours after surgery, output is not expected to equal input. What question is a home health nurse most likely to ask the patient to evaluate the efficacy of cimetidine? 1. Are you still having problems with constipation? 2. Has the medication helped to relieve the acid indigestion? 3. Did the medication relieve the nausea and vomiting? 4. Do you feel like your appetite has improved? The correct answer is 2. Has the medication helped to relieve the acid indigestion? Rationale. Cimetidine is available over the counter and is used to relieve heartburn, acid indigestion, and sour stomach. In which case would fecal microbiota transplantation be considered for a patient with Clostridium difficile infection, CDI? 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. 2. Patient has CDI and a healthy donor who meets the criteria for donation is available. 3. Patient has had a recurrence of CDI after receiving a full course of metronidazole. 4. Patient has many risk factors for CDI and has poor nutritional and fluid reserves. The correct answer is 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. Rationale. FMT is considered after the failure of medication therapy and after multiple recurrences. Vancomycin or fidaxomicin is the first-line therapy. Rifaximin is an adjunctive post-vancomycin treatment regimen for patients with recurrent CDI. Previously, metronidazole was considered a first-line treatment. However, it is now used only when vancomycin or fidaxomicin are not an option for the patient. Which task, related to a nasogastric tube, can be delegated to an experienced assistive personnel? 1. Removing the NG tube at the prescribed time. 2. Securing the tape if the patient accidentally dislodges the tube. 3. Disconnecting the suction to allow ambulation to the toilet. 4. Checking the suction after the patient has ambulated. The correct answer is 3. Disconnecting the suction to allow ambulation to the toilet. Rationale. Disconnecting the tube from suction is an appropriate task to delegate, but the nurse must give specific instructions or verify that the AP knows how to do this task. Suction should be reconnected by the nurse so that correct pressure is checked. If the AP is permitted to reconnect the tube, the nurse is still responsible for checking that the pressure setting is correct. During removal of the tube, there is a potential for aspiration, so the nurse should perform this task. If the tube is dislodged, the nurse should recheck placement before it is secured. A patient with proctitis needs a rectal suppository. A senior nursing student assigned to care for this patient tells the nurse that she is afraid to insert a suppository because she has never done it before. What is the most appropriate action in supervising the student? 1. Give the medication and tell the student to talk to the instructor. 2. Ask the student to leave the clinical area because she is unprepared. 3. Reassign the patient to another nurse and send the student to observe. 4. Show the student how to insert the suppository and talk to the instructor. The correct answer is 4. Show the student how to insert the suppository and talk to the instructor. Rationale. Showing the student how to insert the suppository meets both the immediate patient need and the student's learning need. The instructor can address the student's fears and long-term learning needs after he or she is aware of the incident. It is preferable that students express fears and learning needs. The other options will discourage the student's future disclosure of clinical limitations and need for additional training. For patients with peptic ulcer disease, what is the most important lifestyle modification? 1. Avoiding caffeine. 2. Decreasing alcohol intake. 3. Smoking cessation. 4. Controlling stress. The correct answer is 3. Smoking cessation. Rationale. Smoking is associated with peptic ulcer disease. The other lifestyle modifications may be desirable, but the current evidence does not show strong linkage to the development of or recovery from peptic ulcer disease. A patient with chronic hepatitis C has been taking a daily dose of the antiviral medication Ledipasvir, so Fosbuvir for the past month. Which information is the most important for the nurse to communicate to the healthcare provider? 1. The patient reports mild headaches that come and go. 2. The patient complains of feeling chronically tired. 3. The patient has missed a period and is having unprotected sex. 4. The patient reports nausea and occasional diarrhea. The correct answer is 3. The patient has missed a period and is having unprotected sex. Rationale. During pregnancy, this medication is prescribed with caution and only if clearly needed. The healthcare provider must discuss the risk versus benefits with the patient and then decide to continue or discontinue the medication. Headache, fatigue, nausea, and diarrhea are common adverse effects of Ledipasvir. Sofosbuvir and should be reported if persistent or recurrent. The patient needs diagnostic testing to confirm symptoms of peptic ulcer disease, and a healthcare provider tells the nurse that the patient prefers non-invasive methods. Which brochure is the nurse most likely to prepare for the patient? 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. 2. How your doctor uses a barium contrast study to detect peptic ulcer disease. 3. Esophagogastroduodenoscopy, the major diagnostic test for peptic ulcer disease. 4. Common questions and answers about nuclear medicine scans. The correct answer is 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. Rationale. H. pylori is frequently associated with peptic ulcer disease, and the organism can be detected through breath, blood, or stool. Esophagogastroduodenoscopy is the best test for peptic ulcer disease. However, it is considered an invasive procedure. A barium contrast study may be ordered for a patient who cannot undergo an endoscopy. A nuclear medicine scan may be ordered if gastrointestinal bleeding is present or to detect gastric emptying disorders. The nurse is taking a report on an older patient who was admitted with abdominal pain, nausea, vomiting, and diarrhea. The patient also has a history of chronic dementia. Which comment by the night shift nurse is most concerning? 1. The patient has a flat affect in rambling and repetitive speech. 2. The patient has memory impairments and thinks the year is 1948. 3. The patient lacks motivation and demonstrates early morning awakening. 4. The patient has a fluctuating level of consciousness and mood swings. The correct answer is 4. The patient has a fluctuating level of consciousness and mood swings. Rationale. A fluctuating level of consciousness and mood swings are associated more with acute delirium, which could be caused by many things, such as electrolyte imbalances, sepsis, or medications. Information about the patient's baseline behavior is essential. However, based on knowledge of pathophysiology, the nurse knows that flat affect in rambling and repetitive speech, memory impairments, and disorientation to time are behaviors typically associated with chronic dementia. Lack of motivation and early morning awakening are associated with depression. A sudden change in the level of consciousness and mental status of a patient signals a need to conduct further assessment for an acute process. This question requires the ability to differentiate between acute and chronic disease processes and accompanying symptoms. The nurse is caring for a patient with peptic ulcer disease. Which assessment finding is the most serious? 1. Projectile vomiting. 2. Burning sensation 2 hours after eating. 3. Coffee ground emesis. 4. Board-like abdomen with shoulder pain. The correct answer is 4. Board-like abdomen with shoulder pain. Rationale. A board-like abdomen with shoulder pain is a symptom of a perforation, which is the most lethal complication of peptic ulcer disease. A burning sensation is a typical report and can be controlled with medications. Projectile vomiting can signal an obstruction. Coffee ground emesis is typical of slower bleeding, and the patient will require diagnostic testing. The nurse would be most concerned about a prescription for a total parenteral nutrition fat emulsion for a patient with which condition? 1. Gastrointestinal obstruction. 2. Severe anorexia nervosa. 3. Chronic diarrhea and vomiting. 4. Fractured femur. The correct answer is 4. Fractured femur. Rationale. A patient with a fractured femur is at risk for fat embolism, so a fat emulsion should be used with caution. TPN is commonly used for patients with GI obstruction, severe anorexia nervosa, and chronic diarrhea or vomiting. When a patient is being prepared for a colonoscopy procedure, which task is most suitable to delegate to assistive personnel? 1. Explaining how to assume the side-lying position. 2. Reinforcing the need for a clear liquid diet. 3. Administering laxatives as needed. 4. Administering an enema to prepare the bowel. The correct answer is 2. Reinforcing the need for a clear liquid diet. Rationale. The AP can reinforce dietary and fluid restrictions after the nurse has explained the information to the patient. Teaching the patient about what to expect is the nurse's duty. An enema is not typically part of the bowel prep, but might be ordered if the bowel is not empty or well visualized. The AP may administer enemas with special training and under certain circumstances, such as home care, but in this situation it is unlikely that this task will be delegated to the AP. Medication administration should be performed by the nurse.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.